Welcome to Healthy Frontiers. My name is Dr. Bisogni, and this show is dedicated to the education of our viewers. The topic for tonight is precision restorative dentistry. My special guest is Dr. Dr. Feinberg. Dr. Feinberg is a practicing dentist in Scarsdale, New York, Westchester County since 1978. He practiced with Dr. Elliot Feinberg for 23 years, a renowned expert in restorative dentistry. He's the director of the Westchester Academy of Restorative Dentistry. He's a member of the American Dental Association, the New York State Dental Association, the American Academy of Implant Prosthodontics. He's a fellow of the International College of Dentists. He's a former chairman of 2 councils of the New York State Dental Association. He's on the governing board and has been a governing board member of the New York State Dental Association. He's a member of the Scarsdale Rotary Club, Scarsdale Chamber of Commerce. He's written numerous articles and lectured throughout the United States. So I want to welcome Dr. Feinberg to the show tonight. Welcome, Doc.
Thank you.
Pleasure to have you here. We're going to talk about restorative dentistry, but before we start, why don't we just talk a little bit about, why is dentistry important? Some people don't even go to a dentist. And talk about that.
Well, dentistry is a critical component of health. It's part of your body. And if you don't have good teeth, you can't get optimal nutrition. If you have unhealthy gums, that's a direct route for bacteria in your mouth to go right into the bloodstream. And there's some correlation between periodontal disease and heart disease that has been shown. And then also, having a good smile is a very critical component for many people because it gives them self-esteem, which really enhances their entire life.
Yeah, that's a great thought right there. Just the self-esteem, as you said, having a great mouth, terrific. So why is prevention so important in dentistry? We talk about, taking care of symptoms all the time, but how about prevention in dentistry?
Well, in dentistry, the most important thing is the bone and the roots. That's the foundation for dentistry. And when I talk about the bone, I mean the bone specifically around the roots. Right. And the way most people get into trouble with losing their teeth is when something happens to the bone. That's what really periodontal disease is. So we don't know how to grow it back. So everything that we do in dentistry, everything, is geared toward preventing the bone from being lost.
Right. And could that be hereditary? Can it be? I know we've heard different,
yes, there are a lot of things that cause bone loss. The things that we have no control over are things like genetics and systemic diseases like diabetes, heart disease, cancer. All those things contribute to bone loss in ways that we don't really fully understand. But there are a lot of things that we can control. And the number one thing is not letting tartar and plaque and calculus build up, because that can cause the gums to become inflamed, and that can spread to the underlying bone, and you're not aware of it. Yeah,
and that's why it's so important to get your teeth cleaned on a somewhat regular basis. And what do you recommend on average to people get their teeth cleaned?
Well, it really depends. I mean, if you have a healthy mouth, then twice a year is fine. Right. Some people need 3 or 4 times a year because they're more susceptible to periodontal problems.
Okay.
And the things that we can control also include things like missing teeth. One of the reasons why it's important to replace missing teeth is because the teeth around the spaces drift, and the teeth opposite the spaces tend to erupt into the spaces, and then at some point these teeth start taking forces in abnormal directions. And nobody knows at what point the body's not going to tolerate that. And when something gives, it's usually the bone. And then you're talking about the bone in the whole area.
Okay. And that's where the bone loss can get really rampant,
yes.
etc. Okay.
So when you replace missing teeth, you avoid all of that scenario from happening.
Great. And then we'll just talk about x-rays for a moment. Okay. Why is it so important to have x-rays when you go to the dentist? A lot of times people say, I don't want x-rays,
Well, it's not just to look for decay. Yeah. It's also to see where the bone is. We have no other means of seeing where the bone is. And so we normally take a full series of x-rays every 2 years. And the first thing I'm going to do is compare it to the previous set to see if there's been any change. Because if there's been some changes in the bone, you've got to step in and do something because that's going to continue. And people are worried about x-rays, but dental x-rays are not like medical x-rays.
Okay.
You would need like 2,000 dental x-rays to equal 1 mammogram, or 1,750 to equal 1 GI series. And a full series of x-rays is 14 x-rays.
Wow. Okay, that's great news. So what is successful dentistry in your opinion?
Well, successful dentistry is dentistry that lasts for a long period in health. You want your dentistry to be resistant to decay, resistant to periodontal disease or implant loss. You want to have a contingency plan if you have a weak area that's not going to jeopardize the whole case, and you've planned for it. So if something happens, and you don't have to do anything over. And you want your patients to be comfortable at all times, because if somehow they get it in their minds that you don't know what you're doing, or you didn't do the right thing, or they're having all this trouble, then that can compromise the success of the case. And lastly, dentistry is not lifetime. And what determines whether or not somebody gets to keep dentistry for long periods of time is changes that occur. I have some patients with dentistry in 40 years, and they didn't have to change the cases because the changes were minimal. And I have other patients that should be changed every 10 or 15 years, and it can be a very, very tough call.
Sure. And so, why is a thorough examination and treatment planning critical to the overall success of dental implants and dental treatment, let's say dental treatment?
Well, I think you have to have an overall approach that not just takes into consideration filling a space or filling a hole, which is a piecemeal approach, which is really what mainstream dentistry does, but an overall approach to where this patient is going and what's going to be tomorrow with this patient, so that whatever you do today isn't compromised tomorrow if this happens or that happens. And that really takes a lot of thought. So when I examine a patient, I take x-rays and study models, and I chart them and take pictures, and I sit down and think about everything. I take also into consideration their needs, and then I come up with a whole plan. I let them know what's good, what's bad, and I have different options, because there's no one-size-fits-all, and you want to choose really what's best for that patient.
Sure. Okay, so what is there's a three-dimensional approach to crown and bridge work. I want to talk about that a little bit. Crown and bridge work. So what is that three-dimensional approach?
Well, the way we're all products of like a departmental approach in dental school, where first you go to the perio department, you do perio, and then you go to the crown and bridge department and you do crown and bridge work. A three-dimensional approach is a little different, because when I prepare teeth for crown and bridge, I'm preparing the tooth, the gum, and the bone at the same time, so they relate to each other, so that I can get the most ideal architecture for that dentistry.
Okay, great. And how does this approach prevent decay, periodontal disease?
Well, everything boils down to engineering as far as preventing periodontal disease goes. So when I do dentistry, I want to have the dentistry up close to the bone. So I want to bring the forces down close to the supporting structures. I want to make the teeth smaller, and then sometimes I tie them together so that they help each other out. And that helps the body resist periodontal bone loss. And as far as decay goes, my crowns are based on the mason jar cover, which is the best known thing ever devised for preserving. And so I rarely get decay under my crowns. Rarely, almost never.
So if you get decay under a crown, what would have to happen? I mean,
well, you have to redo the crown, most likely. Anything that you put a filling in is a temporary patch-up. But it's normal to have some changes. And after many, many years, you could have changes where the roots that were once way under the gum are now exposed. And sometimes people become very susceptible to decay. And if patients aren't going to change their dentistry, maybe they have to come in extra for hygiene and take extra care of that area.
Yeah, especially with kids and whatnot. We were just talking about this with flossing and just brushing. Let's get to the simple part of this, all right? I mean, it could start when, as a child, when you don't get into the right habits, or as a parent, we have to teach our kids the right things to do. Is that correct?
Absolutely.
That's where it all starts. So, all right. So, what is precision, preventive, and restorative dentistry? Something that you specialize in your office and your practice.
Well, everything is done just so. I said, two-visit crown and bridge can't fit properly. There's too many things that can go wrong. Bacteria are nanometers. So if there are so many steps in dentistry where error can be introduced, so that if you skip steps, then you're more likely to compound all the errors and not know what the errors are. So I don't skip steps. Everything I do, I want the perfect result, because what does it for me is when that patient comes in for hygiene year after year, I want to see that case last in health.
Yeah, okay. So you have a unique approach in your office, and how does your approach differ from general dentistry? We were talking about that a little bit. So.
Well, most dentists and all of mainstream dentistry, they try to hang their crowns off of what's sticking up above the gum. And so if they don't have enough sticking up above the gum, then they got to try to build it up so that they have enough to hang a crown on. Sometimes they take away a lot of bone in order to have something sticking up. And sometimes they do root canal so that they could put posts in to have something sticking up. And if that doesn't work, then they extract the teeth and put an implant in. See, I don't do that.
Okay.
I go below the gum and get a good grip on the root.
Okay.
So I don't care if there's anything sticking up above the gum. And the way, see, I have, these are models of teeth. These are, if you could see here, these are models of teeth that exact duplicates are flush with the gum. And I don't build them up with posts or anything, but I go below the gum and get a good grip on the root. So the difference is most patients, when they go to the dentist, get a rubber impression, and the rubber cannot go down very far. Whereas I take individual impressions with copper bands and go down below the gum and get a good grip on the root. So the result is that the dentistry fits. And it fits so well that I typically have the patients wear their crown and bridge work on a trial basis with either Vaseline or with rubber, and they don't fall out. It's not normal to have crowns fall out. That's anytime the crown can fall out, it's a suspect, because if it can fall out, it can decay and cause lots of troubles.
Yeah, great. Okay, so can you save hopeless teeth? I mean, patient comes into you and the teeth are in really bad shape. Can you save those?
Yes, because we have this approach to dentistry. We can save a lot of teeth that people are extracting and placing implants.
Right.
I see this with a lot of patients where they're getting a piecemeal approach. Wherever there's a space, someone's putting an implant in.
Right.
And sometimes those roots have a lot of bone and have a very good foundation for a crown. But because it's rare that today that people have good crown and bridge skills, and more commonly people have great implant skills, the patient isn't even offered a crown and instead of having an implant placed.
Right, which is a much more advanced and much more involved protocol, right?
And I think implants are great because we've been doing them since the early 80s, but that's my last resort, not my first.